discuss about today. I'm going to discuss about headache, tension headache, pathogenesis, clinical picture treatment. Yes. So headache is a pain or an unpleasant sensation that occurs apart from the eyebrows to the cervical-occipital region. The term headache includes all type of pain and discomfort localized to the head, usually scalp. So it's very common phenomenon. It occurs at least once in almost every person, and recurrent headache occur in almost 40% of people. It an occasional headache is not considered as disease. It's usually treated on its own, often with over-the-counter analgesics. So, consequence of violation of regulatory process provoked by living condition, including psychological on background of congenital predisposition. So, the body is the common denominator of a wide range of disease. Statistics show that in 90% of cases when patients go to the doctor for a headache, chronic functional headache from the neurological group of migraines and spastic pain level. So the mechanism, headache formation mechanisms, as you see in these pictures. So firstly, structure that directly provide pain reception, basal parts of the dura mater. After that, the walls of the venous sinuses, like vessels of the arterial circle of the cerebral hemispheres, extracranial arteries, tissues converting the bones of the skull. So the fifth and ninth and 10th cranial nerves, subarterial roads. So for sinus pain is behind brow bone and or cheekbones. The cluster one vein is around one eye. The tension one is like a band squeezing the head. And the migraine one, pain, nausea, and visual change are typical classic form. Others are in the individual response to pain for irritation depends on activity of nociceptive systems, concentration of potassium ions, acetylcholine, serotonin, substance P, activity of the anti-nociceptive system. So headache is like a manifestation of the deficiency in the anti-nociceptive system. Causes of headache. There are many reasons for headache. So in 1998, International Headache Association classification of headaches. There are 30 sections, each of which contains several points. The main sections include migraine, tension, headache, cluster headache, pain associated with vascular disorders, head injuries, infections, neck and skull disease, etc. Type of headaches. First, we have vascular headaches. It's usually pulsating, develops in case of discrepancy between pulse, blood volume, and vascular resistance. Second, headache of muscle tension. Third, dynamic headache is observed when intracranial hypertension, burstring like pain aggravated by coughing, straining depending on the position of the body, and intracranial hypotension, like as a result of loss of cerebrospinal fluid cushion, the pain increases while sending, decreases when the head is titled. For the fourth type, it's called neuralgic, like sharp cutting. Like this type of pain is characterized by attacks, existence, irradiation to neighboring or these areas. So frequent types of headaches. Chronic daily or nearly daily headaches. So women suffer from chronic daily headache 5-6 times more often than men. This is one of the most common causes of long-term disability, malgresement in every day. So this headache is usually monotonous, much less often it has a pulsating or squeezing character in the form of helmet and hope. Almost always the pain is diffuse and bilateral of moderate intensity. The headache is aggravated by physical fatigue, emotional stress, head movements, bad insufficient sleep, irregular meals, alcohol, change of weather, rest and sleep can help relieve headache. feeling of pain is controlled by neurosensory mechanisms that are part of the antinociceptive system. So antinociceptive system, it can be firstly neurogenic mechanism, like inhibition of ascending pain impulse by effect of neurons, gray matter, a number of subcortical structures, cerebral nucleus. Second, humoral neurotransmitter mechanism, physiologic system, noradrenergic system, GABAergic system, and serotonergic system. So tension headache. Tension headache is characterized by the following symptoms: has a compressive or squeezing character, pain of mild to moderate intensity. Pain can reduce the effectiveness of the activity but does not limit it. And bilateral headache, no aggravation from physical exertion. There is no nausea or vomiting. Loss of appetite may occur once on 15 minutes of month. The high frequency of attacks characterizes the chronic form of tension headache. So here we have some areas of the pain on the different types of headache, like the sinus 1, cluster 1, tension 1, migraine 1, neck 1. So for example, the migraine 1 pain, nausea, and muscles change are typically classic form for about the tension 1 pain is like a pen squeezing the head. About the neck 1 pain is the top and back of head. So that's all. Thank you for your attention.